Welcome to the Unbreakable Bone mini-series. I'm Dr. Vonda Wright. I'm an orthopedic sports surgeon and specialist in women's health and longevity. You know, you can't read anything or turn on any part of the digital world without understanding that people are fascinated with longevity, how to live longer better, what peptides to take, what exercise to do. But one subject that we are not talking enough about is our bone health. You may not realize it, but bone failure, failure of a bone like this, your femur, is one of the strongest predictors of late life mortality and loss of independence. Sometimes we think of bone as just scaffolding, like an I-beam in a building, and don't realize that it's living, it's vascular, it's metabolically active. It has a variety of jobs in our body. And so over the course of this mini-series, we're going to cover all of it. But before we do, I want to make a case for you about why you should even care. You may have heard of something called osteoporosis, which translated means holes in the bone, osteoporosis. Osteoporosis is a state of bone health where you are much more likely to fracture. And the fact of the matter is that osteoporosis is not rare. It's not merely cosmetic. And good news is it's not inevitable, but it can be clinically lethal. So let's talk about it. 10 million people in this country have osteoporosis, with another 44 million having low bone density. Fully 1/2 of women over 50, 1 in 2. So that if you're a woman watching this right now, it's either statistically going to be me or it's going to be you. 1/2 of women over 50 will break a bone, and often it's this bone, the femur. And it's not just women. 1 in 4 men will break a bone when they're over 50. And globally, this accounts for 200 million people. But here's the thing, less than 20% of everyone with osteoporosis is ever diagnosed or treated until you present with a fracture. But what's the big deal about fractures? You break a bone, you put a cast on it, you get better. Well, not always. 1 in 2 women over 50 will break a bone. And when that bone is a hip fracture, this is a femur, it's the largest bone in your body. A hip fracture occurs in this region. When you fall and break your hip, you have a 25 to 30% chance of dying within the first year, especially when you're over 65, up to 30%. That's devastating. It doesn't mean just waiting for the bone to heal. It means that there is a high chance of mortality. And for those people who survive the fracture, 50% of you will never return to pre-fall function. These are devastating statistics, and only one of the many, many reasons that we should be concerned about our bone health. But before we get to how to prevent this, let's talk about how does a hip fracture cause such high mortality and very high morbidity? Well, what you may not realize is that when you break a big bone like this, it requires surgery most of the time. And often, if our fractures happen late in life, we're already so metabolically sick. Maybe we have diabetes. Maybe we have extra pounds. Maybe our heart is so sick that we can't have surgery. Or maybe, like so many women do, we have chronic urinary tract infections, which can lead to the mortality that we're talking about. But why else are fractures so prone to taking the life that you are used to, independent, living in your own home, away? Well, you are immobile for long periods of time. And when you are, that will cause rapid muscle loss. Without your muscles, you're not able to get up from a chair and live independently. How fast do we lose muscle? Well, these statistics they're not only staggering, they're so surprising. Did you know that when you fracture a large bone and have to be in bed, that you can lose between 1% and 3% of your muscle daily? And if you're an older adult who's already fragile, up to 5%. Within 2 weeks, it's estimated that you will lose up to 50% of your lean muscle mass in the critical areas of your legs and your core. Research shows that the strength of the muscles below your belly button, your glutes, your hamstrings, your quadriceps, and your core are predictive of longevity. On top of that, rapid loss of muscle is critically involved in your metabolism and insulin sensitivity. So a week in bed can decrease your ability to be insulin sensitive and have a normal metabolism by 30%. The rapid muscle loss accumulates such that in as little as 2 weeks, you can lose 15% or more of your muscle in critical areas like your legs and your core. Layer that on with your infection risk and your loss of independence, it is catastrophic. So as I'm describing these things to you, my goal is not to scare you. My goal is to activate you, to help you understand that bone is not just silently hanging out in your body, holding up your muscles, giving you human form. My goal is to motivate you to care about your bones, because bone loss seems like it's silent. You don't even know it's happening. And I contend to you that maybe we just aren't listening well enough. Bone loss seems silent, but when it manifests as a fracture, it can be catastrophic. And here's the thing. Women are disproportionately affected. And why is that? Well, men and women age differently. I mean, anybody who thinks we don't is just not curious enough. Both men and women will reach peak bone density around 25 to 30 years old. And then for a little while, we level off, and both men and women will lose about 1% of their bone density a year until perimenopause. And we're going to talk about this much more in the future. But during perimenopause, when our ovaries are beginning to retire and we have significantly less production of estrogen, it has an accelerated and profound effect on our bone's ability to rebuild itself. Estrogen is critical for maintaining the balance between resorbing bone and building bone. And when estrogen is not present, women will have an accelerated loss of their bone density from the plateau of about 1% to more than 3% a year. So in those years when you're just trying to figure out, how come I feel so horrible in perimenopause when my estrogen is going away, you are silently losing between 15 and 20% of your bone density. So what happens to women when we're losing that much muscle and we're losing that much bone in your perimenopausal period? What happens if we never built a lot of muscle and bone? So this conversation about bone health is not only for people in their 60s, 70s, 80s, and beyond. The conversation about bone health begins in our 20s, because here's the deal. All these statistics that I am talking about, including being diagnosed with osteopenia, diagnosed with osteoporosis, if we step in front of it in our youth, in our perimenopausal years, osteoporosis is preventable. We can build better bone. We can retain our muscle mass. And when we know, we can act. Here's how I want to reframe fractures for you. Osteoporosis is preventable. Fractures are not the accidents that we say they are. They are predictable failures of skeletal integrity. Let me say that again. It's not just by chance that our bones fail us. Our bones are talking to us all the time about their health. We just don't know how to listen, and we don't know how to intervene. I am framing for you that fractures of the femur, fractures of your wrist, fractures of any bone are not just tripping and falling accidents. They are the predictable failure of skeletal integrity. Here's the catch. We don't actually die from osteoporosis. The 30% of people who die after a fracture are dying because this is what happens when bone fails. So I know these data today sound sad, and hopefully they do not sound inevitable. The next episodes in our Unbreakable Bone mini-series are going to talk to us all about bone biology, how to prevent osteoporosis, and how you can build an unbreakable future.